So yeah, it's hard to look as we again temporary measures, titrated, it'll just keep a pause on the situation. I think as Dr. Fauci said, right now there's a lot of obviously every other day probably the most important thing whether or not there's expansion that will sustain community human-to-human transmission. Right now, that is limited in large part to many areas. We've had some isolated human-to-human transmission. Some of the cases that are international. We've had 12 so far that have been defined. So that's
For 206 Japanese workers based in Wuhan, this was a most welcome return. A flight that brought medical supplies to the Chinese province fighting to contain the coronavirus delivered them back to safety in Japan. The first of some 650 Japanese citizens scheduled to be repatriated. On home soil, they spoke of the situation they were thankful to leave behind.
A World Health Organization expert says it is impossible to tell when the Wuhan coronavirus will peak. New cases are still popping up around the world on a daily basis. In mainland China, at least 132 people have died, and there are more than 6,000 confirmed cases. 91 cases have been reported elsewhere. Now, the WHO says human-to-human transmission outside of China is, quote, deeply concerning. Their emergency committee is set to meet Thursday to decide whether it is now an international emergency. In Seoul, South Korea, potential coronavirus cases are being examined in temporary facilities there. Paula Hancox is on the ground.
This is the National Medical Center in the heart of Seoul, and this is where the South Korean government has decided will be the main hospital for those who have coronavirus or those who are suspected with having the virus. Now, we know there is one patient here already on the 7th floor in this building behind me. You can see many of the medical staff not taking any chances. Just inside there, they have their hazmat suits on. And this is the area where those who think they have symptoms of the virus will come. They want to make sure here that those who are worried that they may have the virus are not going to be mixing in with the rest of the hospital population, because there are still plenty of regular patients here. So this is the main reception area where they will come inside, and this is where they will be processed. A little earlier on this Tuesday, President Moon Jae-in came to visit this facility. He wanted to make sure, he said, that everything was up to scratch. He wanted to make sure that enough was being done and the priority was being put on coronavirus. Now, just on Monday, the government raised the alert level to the second highest level that it could be. And what that does, it means that the government takes over the control as opposed to the CDC, and it means there's an emergency task force that is being set up to deal with this as well.
The U.S. Embassy in China is evacuating American citizens from Wuhan, the center of the coronavirus outbreak. More than 1,500 cases are now reported in China, where at least 54 people have died. Here in the U.S., 63 patients have been tested in 22 states. Here's Remy Inocencio.
At Ground Zero in Wuhan, an army of excavators is in a frantic race to now build not one, but 2 hospitals to treat over 2,000 people infected with the coronavirus. As patients continue to pack into hospitals, supplies are running low: masks, gloves, and surgical gowns. The city's highways, train station, and airport now sit empty after officials restricted access out of the sprawling city of 11 million people.